Well, this is, again, the really exciting part of the work, is that by being a really high quality early childhood program, you are actually helping to strengthen families. And the Strengthening Families Project actually identified 5 protective factors or 5 areas where programs could really help to be targeted and to strengthen families. And one is enhancing parental resilience. 2 is social connections. So an example of that would be sort of the types of gatherings that you have for families and the types of ways that you connect families to other families. The third thing is increasing parental knowledge. And so I think already many centers offer opportunities for parents to receive training, for parents to come to sort of support groups, or for parents and staff to receive training together. Some centers have libraries and materials that they regularly send out, and even basic things like modeling appropriate sort of child guidance goes a long way in increasing parents' knowledge of child development and child guidance procedures. The fourth item that they identify in terms of strengthening families is helping families who are in crisis or helping families who need concrete supports. And so I think sort of on the program level, that really speaks to having relationships with other services and agencies so that you can refer families who have particular needs, such as mental health services or healthcare needs. You can, you know what the resources are in your community, and you can make that direct referral for them. The fifth item is promoting children's social and emotional competence, and that is something that a good every really early childhood program does anyway. And so to have the knowledge that when you're promoting young children's social and emotional competence, you actually are helping to strengthen family, because now the child can communicate their needs more clearly, they can begin to regulate their own behavior, they can get along with peers, those kinds of things.
I think that protective factors, I think one of the beauties of the protective factors is that they benefit all families. You know, but we know that families are very diverse. They come in all shapes and sizes, and they all have unique needs and challenges. Children tell all. I mean, when they're in the center, once they're verbal, you know, they share all kinds of things about their families, you know, good, bad, and different, you know, and so the child care worker is the recipient of these reports. But it's all not necessarily negative. You know, sometimes there's sharing some very positive things about their families. And I guess what I'd like to emphasize is how important it is for the child care worker to not only just be looking for those things that might be risk markers, but also to look for those things that are real strengths. And that we haven't, and that they seize those opportunities when they're communicating with parents to communicate you know, some affirmation or reinforcement for those positive things that are going on with families. I also think that sometimes children can be the window into how well the protective factors are operating in their families. When I was talking to my husband this morning, who is a child psychologist, and he's active duty, he told me a story of when we were stationed in England, and he had lunch at the Child Development Center there at Lakenheath. And he was sitting at the little table with all the kids, and a little girl turns to him and says, "Are you married?" And he says, "Well, yes, I am." And she said, "Well, we just moved here. My mommy doesn't have any friends. Could your wife be my mommy's friend?" And so I think there's just ways, if we're listening, you know, and we're attentive to how children are communicating about the protective factors in their families, that we might be able to see some opportunities to really make a difference, small but significant difference in the life of a family.